It's your eye health experts, Prevent Blindness Texas, and welcome to Eyespiring, a conversation about all things vision and life.
Hi, and welcome to Eyespiring. I'm Heather Patrick, your host and president and CEO of Prevent Blindness Texas. We are super excited about our guest today. She has a very interesting story to tell and a lot about patient advocacy and the importance of why using our voice moves things forward. Prevent Blindness Texas is an organization, a social impact organization focused on making sure everybody that needs access to eye health and vision care gets it across this state. Last year, we served over 61,000 people. 9,000 individuals received financial services from us, and we educated over 120,000. We have teams and volunteers all over the state serving from children to adults. And we are super excited for this conversation. So let me tell you a little bit about Christine. She's the founder and CEO and executive director of the TED Community Organization, a global nonprofit dedicated to supporting those living with thyroid eye disease. An accidental leader, which I love that. We're going to talk about that. Christine stepped into advocacy by simply trying to help fellow patients navigate the isolating and often overwhelming thyroid eye disease journey. Today, she leads an organization that unites patients, physicians, advocacy groups, and industry partners worldwide to foster education, support, and connection. So, Christine, tell us a little bit about you.
Oh, thank you. And thank you, Heather. Thanks for being here and, for your awesome work. Your reach is long and it's very exciting, when you think about eyesight,
Mm-hmm.
to have that kind of impact on something so important. So, yes, my name's Christine Gustafson, and I am an accidental leader for the TED Community Organization. And there's other parts to me too. I'm an athlete. I swim the mile every day. I bicycle. I love being active. I live in Monterey. And if you've been to Monterey, then you completely understand this because being outdoors is such a joy. I also have a design agency. I design websites and I do marketing. That was my life before I entered this nonprofit space, which was not intended. But I work mostly with hospitality, boutique inns, bed and breakfast inns, restaurants, usually all tourism related businesses, and I help them build ideas that will come to part of this conversation.
Mm-hmm.
But I'm entrepreneurial. I've always been an entrepreneur. I've always worked with entrepreneurs. And we're very used to taking no more than an idea and
Mm-hmm.
building it into something that helps others.
Mm-hmm.
So that's a little bit about me.
I love that. And that is very true, especially I think in the nonprofit sector. There is this component of the entrepreneurial spirit, and I think you have to have it to be able to survive and really thrive and grow. But I love that. So, why does serving the community matter so much to you?
Well, I grew to know why. When I was first just trying to help somebody who had thyroid eye disease, I myself have thyroid eye disease, and I had had it for 10 years. At that point, I had never met another person that had thyroid eye disease. It's a rare disease. And to just give a tiny bit about it is that it's affects your eyes. It is autoimmune and it attacks the tissues around and behind a person's eyes.
Mhm.
And one of the things that can happen is it makes a lot of swelling behind your eyes, and then it's like a cone behind your eyes, and then there's no more room because it fills up with all the swollen tissues and muscles.
Mhm.
And the only place for our eyes to go is out. And so what happens when you have thyroid eye disease is your eyes actually push out of their sockets.
Mhm.
They become red because they're being attacked and because they're exposed. And then there's like big puffy swelling eyes that are red, pushed out. And as you can imagine, the people around us tend to be um, concerned,
Mhm.
and little children become frightened. And so it's not unusual for children to hide behind their parents when they see someone who has thyroid eye disease. On the other side of it, it's pretty devastating as an individual with thyroid eye disease. So to go through the journey alone, seeking medical help, which there has been, at that time, there was not a lot of help for thyroid eye disease. So I simply was trying to help somebody that I had recently met in one of the support groups um, who who needed help for. And so I was asking someone who's in the nonprofit world. I just happened to know her, and I said, you know, I'm having trouble finding help for my friend Fran. And she said, well, it's because there's no dedicated nonprofit for thyroid eye disease. And so I've already told you I'm not from that world. So I said,
Mhm.
oh, does that matter? Like, is that important? And she said, yes, very. And when she said that, oh, Heather, I know that this has happened to you before. I got this big nod from the universe. And it's the kind of thing where you just think, oh, no, don't pick on me. I have a very busy life. I have a very, very busy life. I don't know that space. And I mean, I probably had like five excuses, but I mean, I didn't verbalize them. I just, I felt the nod. And so, and I'm sure, I mean, whether you've had that for, you meet the person of your life and they have red hair and you picture they'd always have brown
Yeah.
hair and, they're short, you wanted them to be tall. And you go, what's going on here? But you know that you're just being kind of funneled into something that is not
Yeah.
exactly your choice. And so, anyway, so yeah, that's really, where it started is I was just trying to help somebody. And what I discovered is that it was richly rewarding,
Mhm.
trying to help other people actually find their own agency.
Yeah.
So let me stop there because I can just go on. So
Well, we're going to talk more about that, right? I mean, I think
yeah.
that is one of the most important roles I think nonprofits can play, and certainly those that are focused on an area like this is really helping people use their voice, right? To find each other, to find support, but also to move changes forward. So take us back to that moment when you were diagnosed, or what led up to being diagnosed with thyroid eye disease, and then what was that like after the initial diagnosis for you? What changed kind of immediately and then long term for you as you walked through this journey?
So when I was diagnosed, I was a really easy case because I had normally with thyroid eye disease, it comes with Graves' disease.
Mhm.
They don't always appear at the same time. In some cases, the Graves comes first, and then the thyroid eye disease comes even 2, 3 years later. But for me, they both came at the same time. And so I had all the symptoms of Graves' disease, the racing heart, uh, shaky, a lot of anxiety. The doctor said, do you have anxiety? I go, oh my God, I have no idea. It's like I just feel terrified all the time. And just, so they ran, and already my eyes were swollen. And I
Mhm.
thought, what's wrong with my eyes? And I thought when I was opening, and it was actually, or I thought it was closing. Anyway, one was opening. So one of the things that thyroid eye disease does is it causes eyelid retraction. So
Mhm.
it's not only pushing your eyes out, but it the the muscle here, it like pulls back. And so it opens your eyes. It seems kind of cruel, because you're thinking, look, I'm already having a lot of trouble. Why is this happening now? So so I had every symptom. So when they ran the blood test for Graves' disease and then the autoimmunity, and they just said it's off the charts. The endocrinologist said this is the highest numbers I've seen. But I swam that morning and I rode my bike to her office and she didn't think they were my numbers. So she made me retest everything. She goes, no, this isn't you. I go, it's me. She says, no, no, it can't be you. She said
Wow.
you would never be in your condition with these numbers.
Mm-hmm.
And it was me. And it's just, I'm just really healthy, but for some reason this kind of entered my life. And what changed after that was um, it became difficult to navigate day to day. And it wasn't like a lot of people get double vision because the swelling, it throws the balance of your eyes off. And so that could be one of the first ways they know they have TED, thyroid eye disease, TED is what we call it,
Mm-hmm.
TED. So, um, but I didn't have double vision, but navigating daily life was mostly um, psychosocial because when little kids would see me and start to cry, it would just break my heart. I wasn't trying to scare them. I just simply walked into a room. And then, of course, I have a business. And so to go see my clients, and they try to be really polite, but like, what's wrong with your eyes? And so it was very apparent. My eyes at the end were almost sitting on my cheeks. They were
Wow.
pushed so far out. And so that part of it, my swim goggles, I had to keep getting bigger and bigger goggles because my eyes were hitting the edge of them. Now, along the way, I hadn't never met anybody that had thyroid eye
Mhm.
disease. So I was navigating this, I have a little cat, Sweet Pea, and my husband. But other than that, I didn't really have any support around me. And the doctors at that time didn't know a lot. They just called it Graves ophthalmology and said, you just have to kind of wait. And it just runs its course for 2 to 3 years. And then once it settles down, possibly we can do surgery to
Wow.
fix your appearance. And so that was the best they could do
Mm.
at that time. Um, so yeah, so then it just became how do I navigate every day? And I'm a fighter, as you can
Mhm.
probably tell.
Mhm.
And I didn't want to be sidelined. I thought, boy, I came from really rough beginnings and I had worked really hard to have a good life. And I didn't want to let it go because I was building.
Mhm.
And I was building a really beautiful life for myself. And I didn't want to now have to sit on the sidelines and watch life go by
Mhm.
because this had happened. I thought, no, I'm not doing that. I'm going to carry on with my life the best that I can. And I just felt like I'm going to get through to the other side.
Mhm.
So,
And here you are.
yeah, yeah. And here I am.
Yeah. So you do call yourself an accidental leader, but really you're not. You just said you're a fighter, right? You're not going to sit on the sidelines. But talk about how that journey into advocacy, into, what did it look like for you? So you recognize there's no support network. You help a friend, right? And you go from that to a global organization that is bringing people together, right, on a regular basis, talking and pushing for change. So how do how did you feel, and what drove you into this larger calling? Because you could, not everybody says, okay, I'm gonna make this a global movement, right? And so that's a big step. So talk about how that calling into advocacy.
So what happened is once, it was suggested about this nonprofit,
Mhm.
probably suggested by the universe,
Yeah.
and it's got to be someone to blame for this. And so I started asking questions.
Mhm.
And so since I'm a website designer, I looked for a URL, what would our website address be? And I was fortunate because there's, the TED Talks people have everything that to do with TED.
Right.
And so, they didn't want to be stepping on their toes for sure.
Right.
And then at that time there was a medication being developed by a pharmaceutical company called Horizon, and they were doing a lot of promotion, and they had everything TED related locked up,
Mhm.
because they had all the pharma bucks behind it. So
Yeah.
Well, don't step on their toes either. So anyway, little
A
me.
lot of dancing in the beginning, wasn't it?
Yeah, little me. So what? So I thought, well, I'd just love to have tedcommunity.org. That would be very great. But what's the likelihood? And I looked it up and there it was. And I thought, oh my gosh, that's such a perfect website. So I put up a survey on the website and then, at tedcommunity.org, that's all it was just a survey. And it was just asking, do you think that a nonprofit is needed? And
Mhm,
if there was a nonprofit, what do you think it should have? Support groups? Should it have um, one-on-one connection? Should it have videos? So I just asked all these questions. Well, they answered it yes, and they answered yes, 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 we'd like to have all these things. And I thought, you guys are really a tough crowd because, now it's like you're creating a lot of work for me. And so it was evident. And I did go to the first call I made really was to Nancy Patterson, who is she started the Graves' Disease and Thyroid Foundation. And so she had been there almost 30 years. And so they had Ted under their umbrella, again, not wanting to step on any toes, but
mhm,
also hoping she had it covered, right? So that's
mhm,
like, okay, universe, look at that. Nancy's doing it. I don't want to be stepping on her toes. I'm going to go back to my life. But no, I called her. I said, "Hey, Nancy, someone told me there needs to be a nonprofit for Ted." I said, "You guys have that covered, right? Like really well." And she said, "Nope, it needs its own nonprofit." I thought, gosh, I wish I wouldn't have asked. So anyway, okay, so it does. So she said, "Honey, I think you should do it." She said, "I'll really support you in that. I really think you should do it." And so she said, "We just can't cover it well enough, and it really needs its own voice." So anyway, that's really where it started. And so all I just tried to do, I didn't try to build a global community. All I tried to do was help people in the way they wanted to be helped.
mhm,
And so I'm a good listener and I could hear the need, I could see the need. And I started talking to people by phone. You know, I you I just it grew to be this, you know, just completely out of control. It's not out of control, but it's far beyond what I really thought. And see, in marketing, like when you have an idea and you build the idea out, you have like what I consider spokes. So you have
mhm,
your center hub in the middle, which is your idea, and then you have your spokes, and those are all your lines of communication out to the outer wheel, which are the people that you're trying to reach. And so I built out those spokes.
mhm,
And that's where marketing comes in because you build out your lines of communication. And the more lines of communication I built, the more people came. And then yeah, so that's how it grew. And there's no borders on TED. It's
mhm,
just like there's no borders on the internet. So what I was doing was going across the world. And that's how people were finding us. Oh, I found you on Google, is most often what they would say. I was looking for help for TED, and I found you on Google, and I'm so grateful. And then I connect people. And they'll tell me about themselves. They go, "Oh, do you want to meet somebody like yourself?" I go, "Yeah." I go, "Okay, I'm going to connect you with somebody." Changes their life.
yeah,
Yeah.
yeah. That's all it is, right? It is the connection. It is, you know, I feel like in this business, in all businesses, right? But it's about the people, right? It's about that connection. And I think that is what is so critical about what we do. It gives people a voice and a connection to build that support network that we all need.
Mhm.
Whatever our issue is, we all
Mhm.
need that connection and that kind of support to walk through it. So, what's been the biggest challenge? So the universe calls you to do this. You step into it. What have been some of the challenges along the way, and how did you work through that?
So when you have a nonprofit, so that's a learning curve. So
Mhm.
you can have an idea, so you build this castle in the air, but you have to put a foundation underneath it, and that's the nonprofit. And
Yeah.
so building a nonprofit was a huge learning curve. And so fortunately, I asked a woman an attorney who is very familiar with small nonprofits and how to set that up. And so we worked together
Mhm.
to build the infrastructure beneath it, get the board of directors, your bylaws, all the different legal things that you need for the nonprofit. And because we were small, they were able to move it forward really quickly. Like if you're big, I think it's probably more complex, but we were little, and so it kind of moved through the legalities, and then um, we got onto the other side of that, and then we had that foundation to build on. And then there's a lot of I know we'll talk a little bit about collaboration, but
Mhm.
the people around me have been incredible from the very beginning. So Prevent Blindness, Jeff Todd is your CEO for your
Mhm.
national
Mhm.
Prevent Blindness, as you well know.
Mhm.
He's probably feels like a big brother to all of us. And he's not related to age, but he's quite an incredible person. I was
Mhm.
introduced to Jeff early on, and so he has been a wonderful mentor.
Mhm.
And other people in this organization, Kira,
Mhm.
there's a woman named Sherry who used to run the Ohio.
Yep. Yep.
Um, and I got stuck at some point in the nonprofit process and couldn't see the way out. And Jeff just called me. He just said, "Hey, I heard you're having trouble." You know how he is like that? It's like,
Yep.
did the universe tell you that? I mean, how did you know? And I said, "Yeah, I'm having trouble." He goes, "Hey, I'm going to connect you with Sherry, and then Sherry can help you get out of trouble." Go, okay, that'd be great. And then Sherry called me. She goes, "Okay, that's a hot mess." She said, "But I can get you out of that." I go, okay, great. And so that's the kind of help that, all along the way, because she had experience and Jeff has experience.
Yeah.
It's like you have experience. I mean, I'm sure that you come into situations where you can mentor someone. Now that's a different experience, right, Heather,
Yeah.
than running the nonprofit is you have a chance. Like, what's that like for you to mentor someone? And I'm turning this on
Yeah.
you.
I mean, for me, that's part of actually today I had a call earlier about, really building leadership. And I think, I mean, I've been doing this a long time. I've been in the nonprofit world for over 20 years. But when I look back over my career, I mean, part of the reason I have been successful is because I had great women who pulled me aside, who helped me think through what I wanted to accomplish, who said, I think if you learn this or focus on this, you can go here and I want to help you do that. And so I think mentoring um, in any sector I think you're in is critically important. I think if we have great lessons learned, we should share those out to help others be successful. I think in the vision space, and certainly I was in the cancer space for a long time. Collaboration is what moves missions forward, right? This is a huge issue. And you can't solve it alone. And I think really understanding how to leverage talent and expertise and leadership and coming together and building movements together is what creates change. And so for me, I think it's critically important to mentor, others and just share what you've learned and help them, hopefully avoid some pitfalls. But also just, I think more than anything, it was so good for me to have, to know people were in my corner, that they wanted me to be successful, and that I could go to them and problem solve. And that was just critically important, and it has been. And I still have mentors, now. I just think it's an important part of the leadership process.
That's beautiful. Well, they put wind beneath your wings.
They do. They did.
Yeah. And it is a very, in the TED community, our like a tagline is never walk alone.
Mhm.
Is that because TED is such a lonely autoimmune and because it's rare, it's very often it's associated with loneliness, depression, suicidal ideation. Um, and this idea of, as you described it with the collaboration, it does something more than just move an idea forward, is it changes you internally, is it makes you much stronger. And I was telling a woman yesterday who's going in for a doctor appointment and she's really frightened. I said, "Oh, don't worry, we'll all be with you."
Mhm.
I said, "You've got the entire TED community with you walking into that office." And that kind of internal change where you're not alone is so rewarding. We had a woman, she's 81, I believe, and she's had double vision because of TED. And she, said, "Well, you get strabismus surgery, clear that up." "Oh no, I'm too old." She said, "And it's not that bad. I could just wear a patch over my eye and I can kind of get around even though I sort of trip on things." We go, "You can get strabismus surgery and clear that up." Well, she did it. And she went on her husband's dream vacation and they were off and on this boat and on this river and did all kinds of very cool things. And she said, "I never would have been able to do that with the double vision because I just couldn't, all the uneven surfaces." And you just see her light up. It's like, why is 81 too old?
Yeah.
It's like
Yeah.
you could do that.
Yeah.
Well, I'm not saying that we're pushing her into it. I'm just saying that we just opened that door and showed her the possibility. So for me, the TED experience was for that 10 years, I was like in this dark hallway and I was kind of like feeling my way along the walls and just thinking, I know there's got to be a light under one of these doors. And it was a long time and I just kept going. And then when I saw that, like I was telling the TED community, I said, when I opened that door, I said, that's where I found all of you. I said, that's what we need to do is we need to keep going until we find that light under the door, because it's there. That's the most important thing. It's there. And so once you know that, don't stop.
Mhm.
And so I think that is really an important message that don't walk alone. You don't need to. and
Yeah.
and, and keep going towards the answer because there is an answer. Like for me, I had 7 surgeries it took to put my eyes back where they belong, and they don't bulge out anymore. I don't have the swelling anymore. The Graves' disease is gone for now. It's been gone 9 years, but these things can come back. So I'm pretty vigilant. Um, so I we call it Ned. That's a whole nother story. We go from Ted to Ned. I'll stop there. Not get myself in trouble.
So, what has surprised you along the way? You get called to do this, you step into it, you're building this incredible support network. And the data shows across the board, regardless of what the disease is, right? Having that support network changes health outcomes. So, you're building this incredible support network. What has surprised you along the way?
So I think the neatest thing, and I'm sure that you can relate to this, Heather, is that just your little self can do something and you can move a needle.
Yeah.
And you just think, wow, look what I did. So I listened to this Steve Jobs interview one time, the founder of
Hmm. Hmm.
our iPhone, which we all have, most of us. And he said the greatest discovery of his life is that when he pushed out into the universe, something happened. And that he could see his own agency. It's like I could almost picture him, kind of like with this hand in this, you know, uh, almost like you can just see the effect, just the energy, his energy going out into the universe. And and so for me, that I could use my own agency, that I could do things that would change other people's lives, um, is really the most wonderful thing. Just like the story I just told you about the woman with double vision, is you think, wow, now she can go about her life however much she has, another 10 years or more, 20
Yeah.
years, but she'll get to enjoy it at a much higher level. And so in the TED community, I mean, agency is a big word for us. And so we look at it more like, of course, it happened to us and we are victims of TED, but what if we change that narrative to a hero's journey? You know, what if we tell ourselves a different story? And see, when we tell ourselves a different story, we'll take different actions. And when we take different actions, good things happen. And so that is at the basis of that. And so I've seen that over and over and over again. And it's very exciting to see when the lights come on. I don't know if you saw the Barbie movie, but there's a scene in the Barbie movie where they're waking the women up. And you know, like when they wake the women up and then they go, oh, you know, it's like I just entered this whole new world. Like
Yeah.
I was in this other world thinking that that was true. And then all of a sudden you're in this world where you think, oh, I have agency. I can do something about that.
Mm.
I can actually improve my life. I can have a better experience, even though I have TED. And so, you know, that's why we say, you know, like, hey, come with us. We're going to Ned. I go, what's Ned? I say, it's no evidence of disease. They go, has anybody been there? "Mm, not really. Let's just see if it's there. Let's find out. I mean, I'm probably in Ned land. Jean's probably in Ned land. But, you know, it's like, let's find out for you. What does that look like?
Yeah.
And one woman said the other day, she said, what Ned is for me is not having to think about my eyes all the time.
Yeah.
That's her Ned.
Yeah. Yeah.
Yeah.
I love that. I love using our agency, right?
Yeah.
So tell a little about exactly, as a global organization now, what does the TED community do? What are you, over the last several years, talk about projects you've done or things that you're really excited about and give the audience a sense of what the organization is doing.
Yeah. So we really actually even haven't been around several years. So we are really new. And the idea was conceived February 22nd, 2022. And then there was a period of the study and
Mhm.
then the building. So last year was our first year to actually have our programs in place. And so, yeah, the global part of it is we have support groups
Mhm.
and they are global. We get asked to do a lot of studies, so we're very active in that. Where there's a great interest in TED right now in thyroid eye disease, by science, by medicine, by the pharmaceutical companies. And so we participate. We even had people come to our house and take our blood. You know, so
Wow.
we not just surveys, but the community itself is very responsive to that. This last year, early in the year, I was meeting with someone and they said, you know, there really should be a conference, like a
Mhm.
virtual conference for TED. I said, okay, yeah, that's a great idea. You know, we could do that the maybe next year or the year after when we're older. And they said, well, we think it should be this year. And so I could really feel like they're pressuring me. Like, what? You know, it's like, come on, you're not the universe. You know, you're just someone from a supporting industry. And so they go, no, because, you know, someone else might do it and we think you should do it. So I'm thinking, okay, well, they got some kind of inside information and they're trying to push me into this. And I just always say yes, and I just don't want to do it. And because we're too young. And so anyway, but I lost. And so I go, okay. And they go, look, you just hire a company to do this conference and just tell them kind of, what you want and they'll do it. And I thought, that's not us. It's like we're organic. We're a bunch of patients. We're very active. I have a whole group I call the TED Builders, and we build things. We build programs. We do very innovative things. And I thought, that's not us to just hire some company and say, just put on this conference. You know what it's going to look like is some kind of corporate produced, entity that's not even relatable. You're just going to have somebody up there with, their stack of slides telling you about TED. And so I said, oh no. So anyway, start down this road and just I'll go very short on it is we just had the conference last week and there were 40 people involved in putting that together. And they're mostly TED patients the TED patients all facilitated. We did every night of TED Awareness Week. We had different topics and we had medical councils came on, talked about the science, the medicines, telling your story, conversations that matter, how you talk to your doctor, quality of life. And does it matter if you take vitamin D? Does it matter if you eat a steak or salmon? Is there some kind of difference in inflammation and does your lifestyle affect TED? It actually turns out it does. So tell us
Mhm.
what we need to do. And so and then we talked to the people who, including Prevent Blindness, like what services are out there for us. Anyway, so we did like this week-long conference. It was all came from us, and it was very successful, and it was global, virtual global, and it was a ton of work to do it, but it was really us. And so we did that. I'm not talking to that guy again though, because I want no more ideas. Like keep your ideas to yourself. It was a lot of work.
It's great.
So
Oh, so let's talk about so you have a business, you have a nonprofit, you have your own health, and you're also an advocate. So talk about how you balance some of that. I mean, I know, we always talk about in leadership, what's the balance? And for me, I always say the really isn't. I just one day is focused on one thing and the next day is focused on something else. I just know where I need to focus. But you have these big things happening. So talk a little bit about how you focus your day on, what's happening or, how has launching this nonprofit, impacted your life?
yeah, so it has definitely added responsibility to my life.
Mhm.
So there's certain things that are non-negotiable to me,
Mhm.
and being active is one of them. So I don't not swim because it's a busy day. I always swim.
Mhm.
And I don't not bike to go somewhere because I could get there faster in a car. Because usually where I bicycle to, if it's the market to pick something up or whatever, and going along the Monterey Bay.
Yeah.
Like yesterday when I was riding, oh my God, it was so beautiful. And this was about eyesight. The sun was starting to set. I was going out by 17-mile drive, which if you know, that's by Pebble Beach.
Mhm.
And I'm going along on my bike, and we've had storms, and so it's extra beautiful. And people are stopping in their cars. The guy in the FedEx truck, he stops right in the middle of the lane, just stops. I mean, there's people behind him. He's got his camera out the window. It's like no one told anybody about this sunset that was going to happen, but everybody saw it. Everybody saw it. Everybody stopped. And it's like you had to because it was just so beautiful. And you think about eyesight, why you want to just protect your eyesight, because the joy that we were all experience was coming through our eyes is to, be able to see something just that beautiful. So for me, like if I just stayed in my office and I got one more thing done, but I never saw that sunset, then it would kill off a part of me. And the part of me that got killed off is that creative part.
Mhm.
that I need to be able to do my work. And so I need solitude. I need these quiet times that are just in when I swim the mile, I do kick turns. So I just go back and forth. People say, "Oh God, you're in the zone." And I'm in the zone. Anyway, I need the solitude. It's one of the most important self-care things I do. And of course, my nutrition and sleep. So all the things that the self-care things is I build my life around those
Mhm.
things. So those are the non-negotiables. And then if something doesn't fit there, like into that um kind of template or
Mhm.
like my little template, then I have to just kind of work with it. Like, I don't know, like I want to get that accomplished, but I'm not gonna hurt myself to do it.
Mhm.
So that's really how I do it is I don't say, oh, I ran out of time now I can't go swimming, because I wouldn't do that.
Mhm.
Non-negotiable.
I love that. So you have clear non-negotiables. You've defined those, and then everything works around that, and that gives
Yeah,
you. I love that.
yeah.
So when you think about globally, um, as you've had people come from all different backgrounds, all different cultures, have you are is there any kind of pushback or resistance depending on where they are in the world? Um, or do they understand or deal with TED differently in different parts of the world?
So it is different because they have fewer opportunities to get the help they need.
Mm,
And then in some cases, there is like there's a prejudice against the way people look.
mm,
So in some cultures, they actually hide the family member that has TED because of the shame. And then in other cultures, I wasn't familiar with it, but I've been learning from the
mhm,
people in that area, uh, a region in Africa where they actually ostracize people for looking different, like having a different look.
mhm,
So I'm always learning. They're teaching me, like what it's like, and then how can we best help them? And so we also have the ability to mentor people
mhm,
in areas so that they can become an ambassador of sorts, like a TED
mhm,
ambassador, and they can build a community in their area. So we can give them the resources to do that. I think that's an important, like you're Texas, but
mhm.
Texas is big. So you may have pockets of individuals that you can support and empower so that they can create communities.
Mhm.
So that is, I think that's important. Does that happen for you at times where because you've got to cover a lot of ground. You can't just do that from one office.
Yeah, our approach is to find people in communities that we can train that become ambassadors. But really, I mean, if we want to be sustainable and if we want the movement to really have impact, yeah, we have to find different voices in the communities, champions in each community. Because we only have a staff of 9, but even if we had a staff of 50, for an organization that serves a whole state like Texas, which we often kid is like a small country,
Yes.
right? But it is so diverse across the state. And so it really does take champions in those communities to move eye health forward. Um,
Hmm.
and to demand sometimes investment in eye health in their community. And we help do that. We help build communities, help them understand why eye health is so important, why investment in eye health and preventative care is so important. And so, yeah, I think it is community by community.
Hmm. That must be really rewarding for you to see, just
I
to
love what I do.
because you're growing something.
Yeah.
And you're growing something that is just what I said about the watching that sunset.
Hmm.
You know, it's very impactful that I heard something when I was reading through your website, and it said something about 50% of sight loss is preventable. Is that
Hmm.
right?
Over
I
50% of vision loss is preventable. Yeah.
I just wanted to, kind of if you could interject that in this, because that's, of course, what we're about too is, use your agency, right?
Hmm.
So what is that? Why is that over 50%? So can I ask you that? Like, what is
Yeah,
the,
absolutely. Well, I think for one, I mean, when you think about diabetes and vision loss, right? Diabetic retinopathy is the leading cause of vision loss in working adults.
oh,
So it just take that population alone, right? Being able to understand why it's critical to get your eyes checked if you're pre-diabetic or diabetic, right? And what that means, and really understanding how the disease can impact your vision. And the thing about vision, as you know, right? For some things, it's unlike most of your body parts, right? Once it's gone, right? I mean, and so that's not the case for every eye disease, but many of them. And so I think the idea for me is when I hear that something is preventable, right? It's right, for the most part we can solve a lot of this. And even if it's not totally preventable, early there is no disease that I know of where we don't say early intervention makes a huge difference, right? So even
mhm.
if you have it, early intervention is key to being able to manage the disease, right? And prevent further vision loss. So I think it's really, when you cut away everything else, understanding how important your vision is to your overall health and being able to emphasize prevention. Prevention is key. Early detection is key. Early treatment is key, to be able to protect your vision. Um,
That part of just education, getting that
mhm,
education out there,
mhm,
because you think about how valuable eyesight is, and
mhm,
just to be able to, so we at the TED community are our next initiative, which is where I was going when this guy interfered and came up with this conference idea, is we're creating a quality of life program. And the quality of life program is so it's a little bit, so Prevent Blindness has an aspect program,
mhm,
and it is a certain number of what I would call modules, where you get together online and you learn things together, and it really makes a big difference in how you're able to view your own eye health of others, how you can tell your story, how you can make a difference, even in Washington, D.C.
yeah,
So I took the aspect classes from Julie.
yeah,
She's a great teacher, great mentor. And anyway, so for the quality of life, it's a little bit that same model, but
mhm,
it's looking at the things that affect you when you have an autoimmune, your nutrition, your movement, like going for a walk is anti-inflammatory. Your sleep hygiene, very important. Your socialization, and so when
mhm,
you have TED, you withdraw. But in fact, withdrawing and loneliness, I heard your speaker who was on your podcast earlier, just a brilliant woman, and she talked about
mhm,
loneliness epidemic, and that certainly affects people that have TED, but inflammation is actually, like, loneliness promotes inflammation. And so you really do yourself a favor to be with a friend and start laughing, because when you do, you lower your inflammation. And so there are some, pretty key things that we've learned from our medical council and our own experience that we're building into this quality of life program that will give TED patients the support and the education that they would need and the community to do it with if they wanted um, to make some lifestyle changes that could
Mhm.
support their journey to healing. And so we want to provide that platform for them. And so the TED Builders and myself, this group of incredible TED patients, um, that's what we're building. And then it will be free and available once we run our pilot program for other TED patients to participate in. And it's just like when Steve Jobs pushed out into the universe and he felt he could make a dent. I think we could make a pretty significant dent in the world of TED if people had the tools that they needed. And right now it's not available. It's a completely unmet need. And so the other part of that is it'll be scalable. So when you have something like that, and like our physicians and scientists that support us will certainly study us and what kind of effects we get. But if it does turn out as we're expecting it will, just common sense tells you that, right?
Yeah,
So
absolutely.
um, it's scalable to any autoimmune or any, you know, that you can use your own agency, that no one's coming to save you.
Mhm.
It's like, sorry, but it's you, like you're the one, you have the agency, you can make these choices, will help you. But once you realize no one's coming to save you, you just think, oh, really? I've been waiting a long time. Oh, well, the wait's over. I guess they're not coming. So, you know, uh,
I think you've already made a big dent. I think your agency has created a huge ripple effect, and it's exciting to see this organization come to life and be a network for TID patients all over the world. And so, thank you for what you're doing. Okay, so quickly for our audience, how can they get in touch with you? What's your website? Yeah, so what's your website? How do they contact you if they want more
yes.
information?
Yeah, that's the main thing. Go to tedcommunity.org. And then everything that you need is there. All the free programs. We have art programs, just very cool art programs. They're free. And then we even give stipends for art supplies and yeah, support groups and just you can sign up for our newsletter so you can stay up to date with what we're doing. And the hello@tedcommunity.org, that's me. So all that email comes to me. Well, they told me, they said, get someone else to answer the email. It's like, you have better things to do. But that's how I learned about the community because I read the emails and I go, oh my God, that guy gets up every morning, looks in the mirror and says, I hate you. And I,
Mm,
I wrote back to him, I said, that's not going to help you. You got to
mm,
change that story
mm,
because you know, I wouldn't know that if somebody else is checking the email. See, I wouldn't know that guy's doing that. And you can't be doing that. Going to connect you to somebody who's going to, help you get a better story.
mm,
And so anyway, yeah, that's the best way is tedcommunity.org. And the contact information is there. And um, yeah, everything that you need to, let me say, we're rewriting our stories and changing our lives.
I love that. Yeah, we and I truly believe this, and this is one of the things we talk about, that life changes one conversation at a time, and you never know where that conversation is going to take you. You never know what's going to be dropped in your lap. You never know, the opportunity there is through that one conversation to have ripple effects. But thank you so much, Christine, for what you are doing, for being that leader, for being that voice. You certainly are making a difference. So thank you. And thanks for being on the show today. and sharing about what you're doing and the TED community. I think it's critical.
Well, right back at you, Heather. I mean, yeah, your work is incredible. I've loved learning about what you're doing and watching your videos and just, yeah, just someone to like really look up to.
Oh,
So,
thank you. Thank
yeah,
you. I love this. I love this space and I love the people in this space. And I feel like we really have the opportunity to make that difference, to use our agency to create and make it a better place. So thank
yeah,
you.
yeah,
So as always, Prevent Blindness Texas is always looking for people to get involved, and there are all different ways to do that. Through our website, you can reach us, call our office. We have tons of resources on our website. We are connected to great partners like Christine. But we are always happy to talk to people and tell them about what we're doing and how they can join us to move this mission forward. And as always, follow us at Eyespiring. And we always end with, we'd love to know what your vision is. Thanks and have a great day.